Welcome back to Tales from the Lab, a veterinary podcast. As you may have noticed, we've made some exciting changes around here. I am your new co-host, Dr. Brad Ryan, Senior Professional Services Veterinarian at Antec Diagnostics.
And I'm Dr. Holly Brown, a clinical pathologist and Chief Veterinary Educator at Antec. Together, we'll be discussing real patients and bring in expert guests to offer deeper insights into the laboratory diagnostics used to solve interesting and challenging cases.
Tales from the Lab is a production of Antec Diagnostics. The intent of this podcast is to provide education and guidance with the understanding that any diagnostic testing and treatment decisions are ultimately at the discretion of the attending veterinarian within the established veterinarian-patient-client relationship.
Thank you for joining Tales from the Lab. This episode includes a guest appearance. Our guest was compensated for their participation. Let's dive into today's episode.
Today, Brad and I will be having a session 2, talking with Dr. Jason Coe with a conversation around communication in veterinary medicine and in the exam room. For those who missed the introduction, Jason's a professor at the Ontario Veterinary College and holds the VCA Canada Chair in Relationship-Centered Veterinary Medicine. After graduating from the college as a veterinarian, he returned from mixed animal veterinary practice to complete a PhD in veterinary clinical communication. Next, Jason joined the OVC Department of Population Medicine, where he has established an active research program examining the human-animal bond, as well as the role of interpersonal communications on the outcomes of veterinary care. He's published over 100 peer-reviewed journal articles. He's co-authored the book Developing Communication Skills for Veterinary Practice, and is regularly invited to speak nationally and internationally at scientific and continuing education conferences. For today's episode, we're going to focus on communication around preventive care diagnostics or wellness testing, which includes infectious disease testing like vector-borne disease screening and fecal testing that many practices are commonly including in their preventive care strategies, but also including an expanding minimum database of a CBC, chemistry profile, and urinalysis, with the goal of obtaining baseline values of health and sensitive trending of any changes to detect disease even before the pet is showing clinical signs, allowing for earlier intervention to help pets live longer, healthier lives. But before we get into the details of those conversations, I think to start, Jason, would you mind introducing to us the concept of value?
Thanks, Holly, and thanks for having me back. I think that's an important starting point in recognizing that value is subjective. It's not inherent, and that value for whether it be a product, a service, wellness testing is going to vary from person to person based on their rating of the usefulness or importance of it. And so even the three of us here having this conversation, if we were presented with an option or an opportunity, would probably see differences in value. And so it really comes back to, how do we understand our client? How do we understand what that client values? And how do we present that to them? I think the other thing that I would highlight right off the beginning that our research has discovered is that when we've done focus groups with pet owners, as well as focus groups with veterinarians about the interactions that they have together, we've delved into that and discovered that there seems to be this gap or disconnect in how we as veterinary professionals perceive value. We perceive value often in the things that we can offer, our time, our service, the products, and want clients to see the value in that. And it makes sense. As a veterinary professional, appreciate the training that we've gone through, the resources we have in a hospital to be able to offer wellness testing. And what we've heard from pet owners or clients is that when they're presented with that information, what's important to them is understanding how is it going to contribute to the future health and well-being of their animal. And there have been several studies in veterinary medicine that time and time again come back and say or indicate that most clients want to understand how things are going to contribute to the overall health and well-being of their animal. So there has been a little bit of this disconnect, and we're working to try and close that, where we can highlight what it is we can offer and how it works, yet we want to really communicate how that's going to benefit the future health and well-being of the client's animal.
You know, because I'm in the field all the time giving this presentation on communicating the value of wellness to pet owners. And, you know, really a lot, I always say, you know, I think there's nothing more powerful. Yeah, you can memorize some statistics on the percentage of pets that are seemingly healthy, that end up having something on their minimum database that warrants either some type of medical intervention, be it a medicine being prescribed or a food being changed, a diet being changed, et cetera. But in my opinion, there's nothing really more powerful than that veterinary technician or that veterinarian communicating stories from the field, things that they're seeing every day, right? So, what are some practical, tangible ways that we can communicate that value, that this is not about necessarily this point in time that your pet is two, but really, like I always say, it's an investment on the veterinarian's long-term ability to make more accurate and efficient diagnostic decisions. Do you agree with that? Are there other ways that we can, are there other key words or key sentences that we could be putting into our conversations with pet owners to inherently communicate that value?
Yeah, Brad, a great, and I think using the stories to share other experiences aligns with that. I'll take a step back to some of the work that we've done looking at how veterinary professionals are currently communicating value in practice. So again, cameras in the corner of the examination room, and we did this study almost 20 years ago and then just recently repeated it, and we found that there hadn't been a huge shift in it. And what we found when we looked at times where veterinarians or technicians talked about cost within the examination room, we wanted to look at how are they talking about that cost in the context of value. And we found that 8% of the time it was just a general cost conversation. So it sounds something like you're going to save yourself $20 today. 74% of the time, it only focused on the time, service, or product that was being offered. So if we think about wellness screening, like to do some wellness screening, it's going to cost $250, end of story. 42% of the time they focused on, or 42% of the time there was a cost conversation within an interaction that focused on the how things were going to work. So it might be something like we like to do wellness screening. What allow us to do is screen kidney and liver enzymes. And only 14% of the time went that next step to really communicate the value in terms of the benefit to the health and well-being of the animal, which might sound like, I recommend we do some wellness screening. It'll be around $240. What it'll allow us to do is track kidney and liver enzymes. And as an example, if we notice that the kidney enzymes are getting up, we'll likely start having a conversation about potentially changing Rory's diet to take the stress off of his kidneys, help him live out healthier, happier life. And if we find that it's in a normal range, what it'll do is it'll establish where normal is for Rory and allow us to track by doing blood work intermittently where Rory is, so that if things start to increase, we can react earlier than we would be able to otherwise when, kidney disease starts to present in Rory where we can see it. And so it really kind of identified that there is this opportunity to communicate value. And I think it comes back to understanding that preventive and wellness elements or testing, there's some challenges to it because the value isn't immediate. And we know that through work, there is this idea of temporal discounting, that a future reward has less value, subjective value today than something where we're going to see the reward today. And so, I think about the idea of if I asked you to do a job and I was to offer you $1,000 today, or I was asking you to do a job with the idea that I'd pay you $1,000 6 months from now, that $1,000 doesn't contain the same value. And so I could probably offer you $800 today to do that job and $1,000 in 6 months for the same job done today. Yet you probably go for the 800 because, again, value sort of decreases over time. And yet we also know that the larger the future reward, the less steeply value decreases. And so the more we can communicate to our clients the benefit, the longer term benefit of wellness testing, the more we decrease that temporal discounting that can occur for a client. So it really is making sure that we come back to and are focusing on what we can do, how it works, and importantly, how this is going to benefit the health and well-being of the animal, which reminds me of a study we did. So we've done a lot of work around nutrition, the reason being that nutrition is identified as the fifth vital assessment, where nutrition assessment and recommendation should be a part of every companion animal's visit to a veterinarian. And one of the things that we've focused in on is obesity conversations. And because of the work that we've done there, we did a relatively complex survey with over 1,000 dog owners. We did a separate one with over 1,000 cat owners. And it's called a discrete choice experiment, where we gave them a hypothetical scenario that their animal was overweight, and we asked them, what of these attributes would motivate you to take action to address your pet's health and well-being? And so the way this works is they basically have 3 different options that have different attributes associated with them. And they're presented with these 12 times. And each time they're presented, there's kind of a random assortment of what's under each of those 3 different options. And then through their decisions over those 12 times, you pick out what is most important to them. And so what we identified for both dogs and cats by far was if clients knew that it was going to impact the life of their pet in terms of how long their animal would live, they would take action to motivate, or they would be motivated to take action to address obesity. And yet when we go to our observational work where we look at veterinarians' conversations around obesity, we actually see that being very infrequently discussed with clients in the context of obesity. And so I think it really speaks to this opportunity we have around preventive care to have these conversations around what the long-term benefits are going to be for their animals, which helps them address their animal's health for the long term. And I think it allows us to really put animals in a position where we're taking care of them, we're taking preventive actions with the hope that they'll live out healthier, longer lives. And so I think that's really important for us to think about how we're communicating the long-term benefit or value of the preventive care that we're presenting to clients.
So I'd love to hear your take on real world phrasing when it comes to wellness testing, how we can make those conversations feel natural, not salesy. So what are some easy prompts or phrases that clinic staff can use to offer wellness lab work to pet owners without, being feeling awkward and having that conversation or worrying about uh, being perceived as having a different intention than they really do have, which is obviously just to make sure that we get as much information about that pet right here, right now. What verbiage is known to resonate with pet owners in your experience?
Yeah. So that's a complex question, and I wouldn't say there is an easy answer. And I think a lot of it goes back to understanding our client and what that client. So it goes back to the point that value is subjective. And so there's no easy sort of phrasing that we can use with every client that's going to hit. And as an example, so we did a study, published it last year, where we're interested in written communication and how veterinary practices utilize written communication to inform clients around preventive care. And we developed 2 paragraphs. One was more feature and function focused. The other was function and benefit focused, with this idea that people would be more invested with the benefit focused paragraph. And so we presented both of them to clients, and we found that 58% of clients preferred the benefit focused information. And so to your point, building benefit into whatever it is we're talking about from a preventive care standpoint is likely going to, not all, but lead many pet owners to want to take more action. We also, as part of that study, randomly presented every participant with either the function, feature and function focused paragraph or the function and benefit. And then we asked them, how likely are you to, after reading this, to talk to your veterinarian about preventive care services or preventive care? And significantly more clients who saw the benefit focused paragraph indicated they were extremely likely to talk to their veterinarian. So again, going back, I think understanding what that client values, recognizing not every client values the same thing, yet we do know that many clients want to understand not only the feature and the function, but how is it going to benefit their animal? And our research would say there's a huge gap and opportunity there in trying to communicate more of that. And so really thinking about how is this going to impact the animal's lifespan? How is this going to impact the quality of life? Like those are the kind of things that we're hearing from clients and pet owners, that they're looking to understand the things that we're offering. And you raised the idea of coming across as being salesy. And we hear from veterinary professionals, like they don't want to come across as being salesy. And yet this is a challenge that I think our profession faces, in that clients, and again, this comes from our work, there's some suspicion towards what's driving our recommendations. Is it the healthcare side and what's best for my animal, or is it the business side and making money? And I do think that if we focus on the healthcare side, the business side will take care of itself. And so we've heard from clients presenting me with options. And I think that there are lots of options that we can present around preventive care as well. But providing clients with options reduces some of that sort of pressure that they maybe experience and really alleviates some of the suspicion around that it's just to drive sales, because there are options and they can work through those options and see what is the best fit for them. And it comes back to communicating value. I think when communicating communicating options, but communicating the value or difference in value between those options, clients are more likely to make a value-based decision than if we just put options and put the cost next to it, because then they're making a cost-based decision. And if I was making a cost-based decision, I'd be going for the least expensive cost. Whereas when I'm making a value-based decision, I'm more likely to choose, if it works for me in my situation, the option that has the most value for me and my animal. And so I do think that there's a lot packed into that, which is why I said at the beginning, like, there's not an easy, yet I do think there's some pretty neat things that we can do in terms of our conversations with clients to really find out what is important to them. How do we communicate value? And oftentimes it'll be making sure that we highlight how this is going to impact the future health and well-being of their animal, and presenting them with options, but not just options and cost, options with the value associated with each of those options in terms of what it offers for them and their animal.
And then they're making informed choices, right? Which is why it doesn't feel salesy to them, right? We've just given them the information they need to make the right choice for them, which makes sense, right? And yet sometimes even with great messaging, an owner still might not be sure. So how can teams explore that hesitation in a supportive and non-confrontational way?
Holly, it makes me think of, again, some of the work we've done, particularly around pet obesity, where we've been looking at stages of change or clients' readiness to make changes to address their pet's obesity. And this is work that's being done in several different areas of human healthcare, addiction, other areas as well, around like, where is a person in ready to make a change? And so when we think about the stages of change, somebody can be in what's called pre-contemplation, which is they don't recognize the need, they're not on board with needing to do that. Then there's the contemplation, and these are the people that recognize, yeah, that's probably important for me to do, yet there's all these reasons that I can't. And so they're really struggling sort of with this ambivalence of, should I do it, should I not do it? And then there's the preparation, action, and maintenance, the last three phases. And so when you've had this conversation and they're not quite sure, it suggests they're in that contemplation stage where they're thinking, yeah, there probably is value in doing this, yet there's all these reasons why I can't, or I'm not in a position to do it at this point in time. And so I think from a communication standpoint, this is where we want to be curious. We want to learn more in terms of what are some of the things holding them back from making this. And so this is where the open-ended inquiry questions that we talked in the previous podcast become so important, to just ask them, tell me more. And it might be as simple as that. Tell me more in terms of what your thinking is, because some of the things that they might be holding back or holding them back, maybe things that we can work with them and find sort of solutions to move them forward and being able to get past that and want to make changes in terms of that as well. And so I think that that can be helpful in relation, is recognizing that somebody who is kind of in that, I'm not quite sure and not ready to move forward, it's really being curious to see, well, what is holding them back? And can we work with that to come up with a plan that's really going to fit and move them into more of that preparation, action, maintenance phase of making a change to pursue preventive wellness testing for their animal in terms of whatever that might be.
I love it, because no doesn't mean never, right? And so we're keeping the door open, right, without being pushy when we dive deeper into figuring out what their concerns are, what they're grappling with, right, and supporting those choices.
I think the thing to recognize too is that, first, when transitioning into those conversations, it can be useful to use what we call signposting, or a very specific type of signposting, which is providing like a transition statement, which is a permission statement, and asking them, I'd like to spend some time just talking about wellness testing for your pet, for Rory, and seeing where they land with that. Now, a lot of people might be like, well, what if they say no? Well, if they say no, chances are they're in that pre-contemplation, and if you force a conversation on them, you're just damaging your potential relationship with them, and you're compromising that trust, which is the foundation of all of these relationships. And so I do encourage a permission statement, just to kind of feel out where that client is and their readiness to have this conversation, and needing to respect clients that say no, because the reality is most of the time when you ask someone permission, it's a courtesy that they're going to say yes. And once they say yes, they're going to be more open to that conversation. Yet if they've said no, they've given you a clear indication that this is not the time. And to your point, it doesn't mean that this conversation doesn't happen. It just means this is not the entry point for that. And this might be where some of our curiosity, learning more about them and their animal and their situation, might play into bringing this conversation up at another point in time. And it might not even be in that interaction. It might be in a future one. And I do think that, as veterinary professionals, we need to give ourselves some latitude too, that not does everything have to happen every time right now. Yet we build this relationship, we develop trust, things will change with our clients, conversations will learn more, creates other entry points. And so recognizing that no is something we need to respect. It also is something that we can recognize doesn't mean that this is not something that can't be explored at another point in time.
Many teams struggle with consistency because people communicate differently under stress. Obviously, vet hospitals are dynamic, sometimes chaotic environments. There could be time pressures involved. And then obviously, we also have a spectrum of financial conflict that we're up against when we're talking about spectrum of care for patients. So given that environment that we're working in, what strategies do you find help maintain a unified message across the hospital without making team members sound robotic?
Yeah, Brad, that's a great question, because I think when we have inconsistency in messaging, it undermines the trust, and then clients start believing none of what whoever says information, right? And so I think that consistency is so important. And it does take a bit of an investment in the team to get everyone onto the same page so that everyone understands what might be the message and why that message exists so that they can get behind it. And so I mentioned in my previous podcast that we've developed this tool at the Ontario Veterinary College called the Value Matrix, which originally was for students to help them think through the different options, what the difference in advantage or disadvantage, so the value in each of these options, and helping them present cost associated with it. Over time, we've come to recognize it can act as a useful communication aid in the exam room, particularly for more complex or for decisions that clients are really struggling to come to a decision with, where we present the options down the left-hand side of a piece of paper or a whiteboard, the advantages and disadvantages across the top, and then we use various symbols, checks, X's, question marks to kind of indicate which option brings which advantage or disadvantage. And then when we bring in the cost. So a few things. One, by using something like this, it really encourages us to present options, but to present the value associated with those options before introducing the cost so that clients can make value-based decisions. We developed it within the context of client communication, and yet we've realized it's been a really valuable tool for teams, where if you pick a wellness decision, you work through as a team what the options are, and you might start by having them in small groups and work through this on their own. They talk about what the differences are in terms of advantages and disadvantages between the different options, and then introduce the cost. The team starts to first identify what their differences are, because it comes out in the conversation of working through this exercise. It also eventually gets people to align by having that conversation, and then people understand what the different options are, what the value associated with, so we can create that consistency of messaging within our team. Because there's, nothing more disruptive to having an inconsistent message within your practice. And so doing something like that can create that consistency of message. That's one way. I think the big piece is just starting to have these conversations and getting input from other, because if you're expecting people to kind of support that message, they're going to be, same as our clients, more bought in, invested in that message if they were part of the conversation that helped support the development of that, recognizing that lots of times we have protocols. Those are a starting point, and it's looking within those protocols. If it doesn't fit for this client, what are the other options there? Because again, as we talked about earlier, by presenting options, it alleviates some of the suspicion that exists out there around our motivations for the things that we offer our clients.
Thank you, Jason, so much for joining us for these 2 sessions on communication. We are grateful for you so eloquently sharing your research and giving us pointers and insights into communication with our veterinary teams, with our pet owners in the exam room and beyond. You've given us tools that will help us, especially when it comes to preventive care testing, as some of our practices are trying to do more. And we know that, again, in speaking to the value, right, that I think that we historically have communicated value based on the medical insights that we are going to gain. And I think that we can now realize that we need to understand the values for our pet owners and speak more to those so they understand why they would make that investment. Listen to new episodes of Tales from the Lab wherever you get your podcasts. And now you can also watch us on YouTube and Spotify.
Be sure to like and subscribe for exciting new content. Share new episodes with your colleagues and follow us on Instagram at Tales from the Lab. That's TAILS from the Lab. We're grateful you're here.